My name is Greg Rupp. I'm a physical therapist for Optimal Physical Therapy, and this is the Buffalo location. Today I'm going to be talking about some of the benefits of dry needling and kind of how it works. So dry needling is primarily used to treat pain due to myofascial trigger points, which are commonly known as knots, which are a taut band of muscle tissue that's kind of, think of it as being stuck, contracted, and dry needling helps release that in the simplest terms. Does dry needling hurt? No. I would call it uncomfortable the first time, and you kind of get used to it, but it's very quick. So most of the patients, pain is not an issue. So dry needling is done by taking a monofilament needle, like an acupuncture needle, and inserting it directly into a trigger point or a knot, which is, as I said previously, a band of that tissue that's stuck contracted. If you include the evaluation, every patient here is evaluated to see if dry needling suits them, and the examination and evaluation can take anywhere from 10, 15, 20 minutes. The process of dry needling itself is very quick. The needle's inserted in piston, meaning it's going up and down for anywhere from 5 to 10 seconds. So Jason here is our demonstration patient. So we're gonna go ahead and assume that I already did the exam and we determined that he's suffering from some golfer's elbow. So treatment will be as such. So you begin by wiping down the skin with alcohol. We take our needles that have varying lengths. This is appropriate for this procedure. So the first step is ask the patient, where does it hurt? Jason, where does it usually hurt? So I'm gonna go ahead and palpate to try to get that, find that trigger point, that top band of tissue, and I feel it right there. So go ahead and spread the skin, let the needle drop, poke it in just to get past the skin. And now we're gonna do that pistoning, up and down. It may have been hard to see, but I actually just felt a twitch response from Jason, which is that it's an involuntary muscle contraction in response to the needle hitting that trigger point, which is exactly what we're going for. Take the needle out. As you can see, there's no blood. It's a monofilament needle. Another example. So say Jason's our demo patient here and he has patellofemoral pain, which is just another fancy word for knee pain. Dry needling with electrical stimulation has been shown to help relieve that in a lot of cases. So can you roll this up for me, buddy? So we're gonna go right for the quads. We're gonna wipe it down with alcohol. Like I said, we're gonna go for the quads. We're gonna go just the medial and lateral side of the quad. So we hit our end point, which is actually the femur, and you pull up just a hair. Now we're gonna go lateral portion of the quad. And again, go to our end point, which is the femur. And come up just a hair. Hook it up to our stim machine. And now, Jason, once these are hooked up, we're going to slowly increase the electricity until you feel like a tapping sensation. So let me know when you start to feel that tapping sensation, or if you feel that tapping sensation. So as you can see here, it's firing pretty good. And to get it, a little more of an effect, we can try to turn up as much as we can to patient tolerance. So Jason, let me know when it gets to a point where you can hold it for 5 minutes, okay? Good there. So we do this for 5 minutes, and as the body kind of, for lack of a better word, gets used to the current, we come back for 5 minutes and turn it up as needed. But this is dry needling with electrical stim for the quad for patellofemoral pain.